We will have in the first session Valuation and Practice by Dr. Ashley Stevens and Dr. Fraser. Uh, in the second session after tea break, we will have Structuring Spinouts for Success. So without going into too much of details about the session, I hand over the forum to Dr. Ashley.
Thank you. So valuation. This is kind of an area that I've kind of pioneered within Autumn. That's me. Dick's upstairs. So if Venture Center took my slides and reformatted them, if they were my slides, you would have seen down here a copyright notice. You know, being a good IP person, I put a copyright notice on. And the copyright would say 1993 to 2025. Most of my slides, the copyright notice starts around 2000, 2005, when I started teaching, went on the Autumn board, started giving a lot of talks. But this one starts in 1993. And as I'll show you, it's kind of a personal journey. And also, I was giving this for Ohio State. They hired me to put on a one-day seminar. And I thought, I've taught this in a lot of countries. I wonder how many. And I went back through my records, and I found I had given it in 26 countries. So this is the talk that has taken me around the world. And you can see India is in there. So if you think about the technology transfer process from a disclosure, assessment, marketing, hopefully getting an expression of interest, negotiation, and a signed deal, here you need to decide your licensing strategy before you can start marketing it. And before you can start your negotiations, you need to have some valuation. So I'm going to talk about valuation versus pricing, how you get value out in a license, the relationship between risk and value, and some methodologies. We'll look at cost, rules of thumb, industry standards, and discounted cash flow. Because this is a 45-minute talk, we will only look at these in very brief overview, okay? I won't take you through a lot of examples. As you start off a license negotiation, you need to ask yourself, what's the product? Is it new market, disruptive? How is value added? Is it a new use, a new product feature, lower cost, blocking competition? And what's the business model for your licensee to generate revenue? What's the market and the competition, both existing and emerging? And what and how much value does your IP bring to the business? This is all the sort of things you'll be covering in your assessment of the technology. What's the single most important factor that determines the value of your IP? What do you think? Market? Commercial utilization? The need for the technology? No, it's the name of the licensee. Okay? They are the person who are going to create value for you. You know, you've done the deal, and now responsibility shifts to them. Are they committed? Are they capable? Are they adequately resourced? So, what do we mean by evaluation? So, the margin over cost, okay? Fair market value. Okay? Think about selling your house, okay? When you go down that process, you start that process, you have a figure in your mind.
Forecasted value after
Yeah.
2 years.
Can we turn down the fan a little, because it's kind of hard to hear people talk with that noise in the background. Yeah. So, you want to sell a car or a house, you have some figure in your mind, right? That's kind of your valuation. There are various techniques to value technology. Frankly, each one will give you a different answer. They say in science, if the reason you don't have to, much better. The reason you don't repeat an experiment is you then have to do a third experiment to decide which of the two previous answers is closer to the truth. But at the end of the day, it's an opinion. The fact that I think my house is worth this much money or my car is worth this much money doesn't mean I'm going to find a buyer who will agree with me and agree to pay that price, right? Pricing, on the other hand, that's the result of a negotiation. If it's a successful negotiation, you have an outcome. You've agreed. If it's an unsuccessful negotiation, you finished up apart. And it becomes a commitment. You're going to sell your house, you sign a contract saying, I will sell it to you for this price, and here's how you're going to give me the money. And the first fundamental takeaway I want you to take from this is that if you have a basis for your valuation, you will negotiate those bases. And that will be a rational negotiation. It may be a tough negotiation, but it will be rational. If you don't have a valuation basis, you negotiate from emotion. And that is an ugly negotiation. So let me start to tell you about my personal journey on this. I got my job at the Dana-Farber Cancer Institute I think I started April 1, 1991. And there's an inbox on my desk with stuff in it. And I discover that I have a hot technology. Does anybody know the definition of a hot academic technology? Huh? Disruptive.
Which would have more than one offer.
Yes. Okay, Lita Nelson, who ran tech transfer at MIT for 35 years, once said, a hot academic technology is one that two companies are interested in. Well, my technology must have been white hot, because I had 3 companies that wanted it. So the first company, we schedule a visit, and they fly from California and sit down with me. And what the technology was the L-selectin molecule, also known as LAM1, discovered by Tom Tedder, a very well-known immunologist. He left Dana-Farber and went to Duke. And it was a cell surface adhesion molecule. And in the early 1990s, they were very hot. L-selectin, P-selectin, M-selectin. We had L-selectin. So this company's coming in, and I've got to make a proposal to them. I have no idea what to do. So I'd spent 10 years in biotechnology, so I knew some people in the pharmaceutical licensing world. So I called them up. I said, I've got this hot molecule, L-selectin. What do I ask for it? And they all said, beats me. So I'd started to get to know some academic licensing people already, so I called them up. L-selectin. Everybody wants it. What do I ask for it? Beats me. So there I am, sitting down across from these people, and we talk about the Red Sox, and then we move on to business. And they say, well, look, we're very interested in this molecule. What do you want for it? And I plucked a number from the air based on the fact that I had 3 people who wanted it, and I put it on the table. And they looked at me as if I had 2 heads and said, why do you think it's worth that much? And I said, well, we think it's a very important molecule. Great sincerity. And they said, well, yeah, we do too. That's why we're here. But why do you think it's worth that much? I had no answer. All I could do was say, well, we think this is a very important molecule. And they said, yes, 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 we've agreed that. But why do you think it's worth that much? What are you comparing it with? What do you see as the revenue generation? And all I could do was say, well, we think this is a very important molecule. And they thanked me politely for my time, got up and left. Thank God I had two others, because Tom Tedder was a very highly regarded professor. And if I had driven away the only licensing interest in this molecule, I think what turned out to be a very successful tech transfer career might have ended very, very quickly. Now, so based on this, I thought, well, there's got to be a better way. And so there were two organizations in licensing, Autumn and the Licensing Executive Society, LES, which is kind of the corporate side. So I went to, each one had 2 annual meetings a year, and I went to all of them. And particularly at LES, any workshop that had the word valuation in the title, I was sitting in the front row. And I was getting more confused, not less. One day I remember I was sitting in the front row, and this guy is going on about the excess value of intellectual property. And I'm thinking, how do I calculate the excess value of LAM1? And behind me, there was a lady from Sandoz, before the Sandoz-Ciba-Geigy merger. And I thought, well, maybe it's just we academics. We're not trained. We don't understand this stuff. So I leant back and I said to her, do you use this technique? And she said, I don't even understand the words he's using. And I felt much better. And this slide basically took me 3 years to write, to finally understand what was going on. So when is technology valued? Well, it's valued retrospectively in litigation, right? When somebody is accused of infringing your patents, well, you only sue them when there's a product on the market and there's lots of money to argue over. So it's done by litigators. And in litigation, I don't know about it, India, but in the US, we have this wonderful tool called discovery. When you ask the other side for all the information that's relevant to you making your case, and they give it to you. And if they conceal it or try to destroy evidence, the lawyers will be disbarred and cannot practice again. So people take this incredibly seriously. So both sides have all the relevant information. And the value is established at a point in time. The jury says, yes, you infringed. The jury will then say, here's how much you pay. And you pay it. I remember early on in the cell phone wars, BlackBerry. Remember BlackBerry? They were convicted of infringing a patent from a little early failed startup. You often see this. Startups try to develop a new market and they fail, but they have valuable IP. I'll give you an example. Facebook was the 3rd social website. The first one was, I think, Friendster, and the second one was MySpace. And Facebook was 3rd. They finished up buying the intellectual property portfolio of the previous 2 when they were sued by Yahoo. Okay? So the pioneers often have great valuable IP. And a judge said, I will enjoin BlackBerry. I will stop you selling. And BlackBerry wrote a $1.3 billion check and paid it at one point in time. That's litigation. But we're not doing that. It's an adversarial process. The judge says, you will pay or you will stop selling. You pay. BlackBerry paid. What we do is we have to value technology prospectively, in advance. So it's done by deal makers. And there's an asymmetry of information. The inventor of the technology knows more about the technology, and the person looking to license it has a better idea of the market, probably. That's why they're there. And, okay, and as we'll talk about, you generally don't get paid upfront in a lump sum in a license. I'll show you, you shouldn't try to be. So you extract the value over time. So as I say, it took me about 3 years to come to this realization. And it's got to be a win-win relationship because, you know, a license is like a marriage. It's going to last for at least the duration of the patent. And I'm currently working on a lawsuit involving cancer diagnostic tests where the hybridoma that makes the monoclonal antibody that's used in the test was licensed. And the deal was, as long as you use it, you will pay. And it's been used for 40 years, so they're getting paid for 40 years. So this has to be a win-win relationship. And in my defense, I was doing this in 1991. And the first book on valuing technologies was Richard Rasgatis's book, and it didn't come out until 1999. So I was ahead of the curve. And that was the origin of this, this talk. As I did my research, as I learned something, I started putting on workshops at Autumn to pass on what I had done, and eventually we put it into the Autumn Valuation course. So what do you mean by evaluation? I think it's a written analysis of what you believe the value of a technology to be. You've got to be prepared to give it to the other side, identify the data you got, discuss the data, and you've got to be prepared to modify it based on your discussions with the other side. Perhaps they've got different data. Perhaps they're saying you've used the wrong valuation methodology. Here's how we think we should look at it. And what do you mean by a license valuation? Constructing the various financial terms of a proposed license, the upfront payments on all these things that we'll talk about. Okay? In other words, the term sheet. And what do we mean by the value of a deal? This is a technical term, also referred to as bio-bucks. It's the sum of all the upfront, all the milestone payments, assuming every developmental milestone is successfully reached, and sales reach a level where every sales milestone is earned, and for every potential product that the technology could lead to. But it doesn't include potential earned royalties. And you sometimes see this referred to as bio-bucks. Here's an example, Amgen and Generate Biomedicines. Here's the press release. And, you know, value of $1.8 billion plus future royalties. They didn't pay $1.8 billion up front. They probably, if Generate was lucky, paid a tenth of that up front, and the rest of it is contingent on what happened down the road. So they got $50 million up front, and 5 times $370 million. Those were the potential milestones on each potential product, and that was $1.9 billion. So I want to talk about risk. There's all sorts of risk in developing a new technology. There's an R&D risk. It may not work. There's an FDA risk. Your product may not turn out to be safe, and it may not turn out to be efficacious. On the physical sciences side, if you're developing something for the electronics industry, IEEE may come out with a standard that doesn't include your technology. You may not be able to manufacture it at an acceptable cost. There's marketing risk. You may have some big company with much more money that is able to establish an inferior technology that gets a bigger market share. Think the PC versus Apple. I think everybody agrees that Apple is a superior operating system, but Microsoft and IBM and all those people were able to establish the Wintel standard and still own the lion's share of the market. A competitive risk. Somebody may come out with a different approach to solve the same problem. A legal risk. There may be a patent comes out there. This is less of an issue today, but until 1999, 2001? No, that was provisionals. I think it was 2001. Until then, US patent applications were confidential. until the patent issued. It was crazy. It meant you could be going along in all good faith, and suddenly somebody issues a patent, and you're blocked. There was a very recent example of this. As John said, in 1996, we changed the law, and patents are published, and you can see what's out there. But anything that was pending before 1996 could be prosecuted to issuance and would suddenly pop out. And it would have 17 years from the point of issuance of the patent. Now it's 20 years from the first filing of the first patent to which you claim priority. And Merck was developing a biosimilar, I think it was of Enbrel. And suddenly Amgen got a pre-1996 patent issued. This was about 2015, I think, 2016. So they're going to get till 33, okay? Merck wrote off the project the next day and took a $300 million write-down for what they'd done. So there was patent risk, and I think it's much more rational to publish patent applications after 18 months, and the US finally joined the rest of the world in realizing that that was the right way to go. Overall, 1 in 10,000 drug candidates makes it to FDA approval. 1 in 3,000 raw ideas make it to market. And this is the really scary one. Between 1/3 and 2/3 of new product launches by sophisticated consumer product companies fail to recoup their investment. So R&D is very risky. And there's a very fundamental relationship between value and risk. As risk goes down, value goes up. So our academic technologies are here at the very beginning when the risk is highest and the value is lowest. And as the licensee develops the technology and takes the risk down, the value goes up. And I think a fundamental principle of license valuation is we probably shouldn't even try to get paid upfront in full. Our job is to extract the value over time and share in the growth of that value. I'll give you an example. One of my favorite examples, Gatorade. This sports medicine drink. Do you have it in India? Okay. Invented at the University of Florida in the late 1950s, early 1960s by this guy called Robert Cade, who came and talked about it at Autumn. And I went and visited him. I'm fascinated by this. I want to write I've written a big article on it. I haven't got it published yet. But he offered Stokely Van Camp the rights to a Gatorade for $1 million. And he had a patent application, a trade secret formula, and a trademark. Okay? And Stokely Van Camp declined. They said that the test market was going to cost $1 million. And if they gave him $1 million, then they'd be doubling their risk. So they wouldn't do it. But they said, instead, we'll pay you royalties. And so if we're successful, you'll be successful. And to date, Stokely, who got bought by Quaker because the product was so successful, who got bought by Pepsi because Gatorade was so successful, have paid about $2 billion in royalties. Now, the University of Florida will only tell you they paid about $300 or $400 million. That's because there was a massive lawsuit between the University of Florida and Cade won, and the deal was he gets 80% of the money, and he shared it with a bunch of people, and the University of Florida only gets 20% of the money. But you can see, Stokely Van Camp could have paid $1 million in about 1965. Instead, over the next 60 years, they paid $2 billion. And it was probably a good business decision. So where is value extracted in a license? Well, you should always get an upfront fee. You should always get something upfront for signing over your technology. There will be ongoing payments before the technology gets to the market. You're part of your upfront fee, you'll want the sunk patent costs reimbursed. and you'll want your ongoing patent cost reimbursed by the licensee. If you've got an exclusive license, it all comes from the licensee. If you've got a non-exclusive license, you may say, well, I think we'll get 4 licenses, so I'll divide those by 4. And if you get more, then perhaps you rebate, something like that to be fair. And then there are milestone payments. Payments that you get when the technology reaches a certain stage. The annual minimum royalties, payments that you get that as long as they've got the license, when they start selling, you can deduct the annual minimum royalties from the earned royalties. There might be research, collaboration, and support. Sub-license income sharing, very frequently with an exclusive license. You pretty much have to give the licensee the right to sub-license. And if you're licensing to a startup, the real value may be when they do a deal with a big company and you have to decide who gets what. And then earned royalties. These are the royalties on products after they've reached the market. There are 3 basic types of payment. Fixed lump sum payments, which are single payments you get as long as the license is in effect. An upfront fee, annual maintenance fee, annual minimum royalties. And then contingent lump sum payments. Single payments you get if certain things happen. Patent milestones. You might say, well, if a patent issues, you pay me this. If developmental milestones, it enters human clinical testing, we get a payment. Gets to phase 2, phase 3, approvals, applications submitted, things like this. And then sales milestones. If sales get to $100 million, you give me $5 million, things like that. If you've got equity in the licensee as part of the deal, then you might be able to sell that equity at some point as they get powerful enough that they can have an initial public offering and you can sell the stock to the public. And then these sub-license payments. And here you're sharing in the increase in value of the technology as it's developed. And then running royalties, the payments that depend on the extent of the licensee's use of the licensed technology. And you'll see some of these payments are made before commercialization, and some, like the sales milestones and the running royalties, are made after the technology enters the market. So upfront payments, a cash fee, including the sunk patent costs, and this reflects the initial value of the technology being transferred, which is frankly pretty damn low at the time it leaves the university. And a new company may only be able to pay in stock. And you probably shouldn't take very much cash from a startup company for the upfront fee. Sometimes only let them pay in stock. Patent costs, milestone payments, these reflect the increase in value of the technology, and they're very common with life science inventions. Yeah?
The earlier slide which you have shown in terms of stocks, I wanted to pause there and have one discussion. So we did one...
Can I cut you off and say we're going to discuss that in another segment? Later today, I'll be talking about that, okay? It was a great question. I'm glad you asked it, but we will get there, okay? So why do you think these milestone payments are very common with life sciences inventions?
Clinical trials, requirement of what's at the initial level for clinical trials.
Exactly. You know, across the world, we have the phase 1, phase 2, phase 3, submit for application approval. And you can say a phase 1 trial, anybody in the world knows what a phase 1 trial is. There'll be no argument about when the company has reached the phase 1 trial or not. Let's say it's software, and you say, okay, you'll make this payment when you enter beta testing. Well, what's a beta test? There's no universal definition of when your initial testing with customers becomes a beta test. So what you don't want is when you get to a point in the development, you have an argument and a fight with your licensee. With life sciences, there's no fights. So all of these. Annual minimum royalties, These are partly a due diligence mechanism, particularly important with non-exclusive licensees. They won't want to go on making these payments if they're no longer interested in the technology. And what you usually do is that they start to escalate substantially after 3 or so years. And these are more common with physical sciences inventions because, as I said, there aren't these universal agreed steps. I mean, supposing you're developing a new chemical process. Obviously, a key step in the development will be building a pilot plant. Well, what's a pilot plant? What scale? 1 kilogram, 50 kilograms, 1% of commercial scale? There's no definition. So you don't want to have an argument. And so with physical science inventions, you say, well, if you're still developing it in 5 years' time, it must be going well, and so you're going to pay me more each year. Sublicense income is really important. With a startup, this may be where the real value is created. And the challenge is you're going to have to negotiate this at the outset before you know how the technology is going to develop, when they're going to do the sublicense, who with, et cetera, et cetera. And your objective is going to be to ensure that the licensee can't game the system by what it calls things in the sublicense. So the solution is the university gets a piece of every payment that the licensee gets from the sublicensee. You will pay me every which way there is, Lou Berneman, who's a former president of Autumn, once very famously said. And you exclude items for which there's a deliverable and documented things like research support payments, purchases of equity. There are 3 models that we've developed. One is a pass-through. The university gets the same running royalty on the sublicensee sales as if the licensee had sold it. You can see that makes sense. If the licensee agrees it's worth 4% of sales, why would it be anything different for the sublicensee? And then they get a set percentage of every other payment received other than running royalties, sometimes called non-royalty income. The other system is an allocation, in which the university gets a set percentage of every payment the licensee gets from the sublicensee. They may say to you, look, I agree to pay you 4%, but what if I work on it for 5 years and I can only get 8% from my sublicensee? I got to give you half? That's not leaving me much of a return for 5 years of effort. So give me a percentage of what you get from the sublicensee. And that includes running royalties. And then there's a tiered allocation when you get a lower percentage of payments received from the sublicensee before commercialization and a higher percentage of running royalties after commercialization. I think in the US these days we've pretty much settled on the pass-through as the model. And the percentages of the sublicense, the non-royalty income, are based on the timing of the sublicense after the license execution. So like in year 1, 25%, year 2, 20%, year 3 and on, 15%. And the thinking here is, as you go further along, more of the value that the licensee is getting reflects their investment in the technology and less the value of the technology they got from the university.
One in the pass-through, that's what mostly we go to.
Yeah.
Will there be any restriction from the licensee to come back to the licensor to take the permission, or else the licensee can independently sublicense it?
So when I joined Dana-Farber in 1991, their license agreement said, you can sublicense, but you have to get our permission. And that's a terrible thing to do, okay? Because think about it. This licensee has probably spent a year developing the relationship with the sublicensee. They're ready to shake hands. And they say, oh, sorry, we got to go ask permission of Boston University. Don't do that. If you trust the licensee, and the reason Dana-Farber said it is, well, we may not like the sublicensee. The answer is, if you trust the licensee with your technology, you got to trust them in their choice of sublicensee that they think is the right person to move it forward. We found in the Philippines, they had a system there. They were, after the Marcoses, they were very concerned about corruption. And so they put this imposition on the universities that before you can sign a license, we have to agree that you've got fair value. I mean, don't I wish that academic technologies were valuable enough that you could peddle them under the table and make money? I mean, don't I wish? But, that ain't the case. And the government agency was taking a year to give this permission. And of course, half the licensees went away. They lost interest. It had taken too long. So don't require permission is my advice.
Since you said Philippines, I was there in Philippines. There, even the royalties are predefined by their funding agencies or the ministries. So they have a structurally built royalty scale. So if you are negotiating as an university, you are predefined to put your royalties within that scale of what has been predefined, which is very bad for the universities as well. Okay?
Yeah, but it should make for a quick negotiation. I mean, if it says 2 to 4%, I think you say, well, we can forget 2%, we want 4%.
No, in giving away the sub-licensing completely, aren't we risking, because everything is on a trust base, the risk factor goes up. As you said, when I was talking about the net profits versus the net sales versus net profits, it's about they might even show the company in the negative with no profits at all. In sub-licensing, if I cannot even have at least the intimation rights, then it becomes very risky for me to even trace out how many sub-licensing have happened.
So, your licensee will negotiate with the sub-licensee.
That's fair.
You should have no role in that.
Yes.
So they're in charge of the technology at this point. And they want to get the best deal they possibly can for them and their shareholders. They're incentivized. Okay?
Intimation rights. Not the approval rights, but at least the intimation rights have to be given to the licensor.
Incubation?
Intimation, like informing them
Just to inform the licensor.
about the sub-licensing.
Informing the.
Oh, yes. Oh, yeah, you have to get a copy of the license agreement. And I once had a licensee in Denmark who didn't want to give me a copy. I said, okay, just come and visit me, bring a copy with you, and I'll read it and see what you've agreed to, and you can take it home. I don't need a copy. I just need to read it, the full license that you signed. Okay? Good. Yeah.
The idea of having an independent organization figure out whether it's a fair deal or not brings, we were doing this in the Philippines, and my question was, okay, how are you going to determine whether it's a fair deal or not? The answer was, well, we went out and canvassed a number of institutions, and here's what they do. And I said, well, that's what the university did. So what value are you adding? And the answer was total silence. The problem, as Ashley pointed out, was they sat on their butts to not embarrass themselves for 6 or 12 months, at which point the licensee just kind of, okay, I've got other things to do. So having someone else, quote, approve, slows the whole thing down, adds absolutely no value whatsoever, because the licensor should have done their homework like that to begin with. Okay? And so I'm adamantly opposed to that for those reasons. However, the national government has an obligation to take a look at how national revenues and expenditures are invested. So keeping them informed is totally appropriate, okay? But having them make a decision based on goodness knows what is going to get you into trouble. So the next question was, okay, fine, approve the deal, and you run into trouble. And you have to modify the deal. Well, you can't do that. You got to go back and talk to the government agency that knows absolutely nothing about the whole thing and try and convince them again as to what's going on. So this sort of resistance, this inertia builds up. In the Philippines, I think they finally arrived at a point which was, here's what we think is reasonable, we publish it, and okay, but I don't know how quickly it is implemented, okay? So I'm like Ashley, I'm opposed for a whole variety of reasons because there's absolutely no way that they add value to second guess whether it's a good deal or not.
The genius of the Bayh-Dole Act in the US was it was very simple, and the government said, you university, go do something with it, and the extent of government interference was minimal. The one thing that had some teeth was the ability to grant a compulsory license. That's only been tested 8 times and never granted, and the rest of the time the government has just sat back and done it. In the 5-day course, somebody said, well, we had an Indian Bayh-Dole Act, and it never got passed by Parliament. And my review of that act was it had some very intrusive government involvement in the technology transfer process, and I frankly was not upset that that law never got passed. I think it would have been unhelpful rather than helpful. Okay, that's my opinion. So, or you could do it at the stage of clinical development. Here's an example, mRNA vaccines, Moderna and Pfizer-BioNTech. The key enabling technology of 2005 Weissman-Carico of our uridine, pseudouridine substitution, and cytidine to 5-methylcytidine. Penn filed patents in 2006. They founded a company in 2007, never got beyond getting SBIR grants, ceased operations. They didn't get a license to the Penn patents. Penn licensed a research reagent company called CellScript in Wisconsin. And the terms were $300,000 up front and a back-end share of income. And they Ribotherapeutics sub-licensed Moderna and BioNTech. The license terms, you can get them from Moderna and BioNTech's regulatory filings. Upfront, $75 million, $26 million milestones, and a running royalty rate of 3.5%. BioNTech reported less detail, 26 million in milestones, pretty consistent there, and low to mid single digits. Well, 3.5% is certainly low to mid. Mid would be 5%, so below that. So you can see it's consistent. Moderna paid $641 million in 2021. Pfizer sales were double Moderna, so I assume they paid twice as much. So the total royalties were about $2 billion, and Penn's royalty income went to $30.6 million in 2020, $310 in 2021, and $1.25 billion in 2022. And Carico and Weissman get 30% between them. So I think their retirement is fairly secure. But, could their income have been $2 billion if they hadn't done that deal? Running royalties, also known as earned royalties, and these are the main post-commercialization economic component of the license. And that's where you're going to get your biggest money if the product is successful. And it's an equation. The royalty payments are the royalty base multiplied by the royalty rate. And they're made for the duration of the royalty term. The royalty base, this you want to see how much the licensee is making use of the technology. So it might be the number of units sold. It might be sales. It might be profits. If you're going to use profits, define very, very carefully. There's gross profits, there's net profits, there's profit after taxes, there's different accounting systems. And why that's important is you're going to need to go in and verify what the licensee has paid you. And you're going to have to hire an accountant to do that. And an accountant will charge you by the hour. And the greater number of numbers he or she has to verify, the greater the sum you'll pay. So, the most common is net sales, which is the gross sales less either standard deductions for things like shipping, insurance, and returns, or a standard deduction, typically 2 to 3%. Do yours in terms of net sales, okay? Royalty rate, this is how much of the licensee's return from using the technology you get. It can either be flat, which means you get the single royalty rate for all sales, or it might be tiered. The royalty rate is different at different levels of sales. Do you think you should get a higher royalty rate as sales go up, or a lower royalty rate? Lower. Hands up who thinks lower. Hands up who thinks higher. Hands up who doesn't want to put their hand up. Okay, we'll see the answer in a moment. I will tell you, by the way, with Gatorade, the rate went down. Okay? But Cade hadn't taken my course. Okay? So the answer is, basic marketing theory says the bigger selling products are more profitable. Right? You've got a bigger volume of sales to spread your fixed costs over. Basic royalty theory, what we'll look at in a moment, 25% rule, says the royalty rate should reflect the profitability. Therefore, as profits go up at higher sales rates, the royalty rate should go up. Okay? It's counterintuitive. You think, wow, I'm going to get more money. I can accept less. No. They're making more. You should get more. The royalty term is how long you get paid. Universities usually use the last to expire patent on a country-by-country basis.
So we discussed the way it can go up, but usually how common is that the licensee agreeing to it, or will they say, no, let's take it on neither, let's keep it constant. Neither yours nor mine, keep it in.
So you're negotiating, let's say, with a small biotech company. They know that when they go do their deal with a big company, they're going to have increasing royalty rates as sales go up. So if you say, look, I want 3% on your sales up to 50 million, 4% up to 100 million, and 5% over 100 million, they're probably going to agree, okay? Because they know that that's reasonable for what they're going to do. But you've got to try and have data. Now, companies frequently use the longer of, the last to expire patent, the expiration of any regulatory exclusivity. In the US, if you have a biological molecule, the FDA can't approve an equivalent molecule for 12 years after that approval, so that can often exceed your patent lifetime. Or 10 years from first commercial sale, or even a higher number than 10. I've seen one license that had 20 years from first commercial sale, which was amazing. So negotiate for that number, 12 to 15. All on a country-by-country basis, and I just don't know why universities don't use that formulation, okay? The company knows it's reasonable, they'll probably agree to it.
So why would they pay after 20 years? Because the legal liability, in your previous slide, you said in some case it could take 10, 15 years for first commercialization. So my patent rights are only restricted to 20. Why would I even negotiate beyond my patent rights when their rights are already expired?
Damn, that is a good question. That is the perfect question. Well, let me do a few more steps and I'll come back to it. Now, you need a royalty step down after the patents expire, okay? It has been ruled in the US a de facto antitrust violation to charge the same royalty rate for know-how as you had for patents, okay? That was in a decision in 1964 that was reaffirmed in another case in 2015. And the 50% step down is traditional. You get half the royalty rate for know-how as you got for a patent. But 10 to 25% step down certainly meets that test. So I can't answer your question, and I've asked it myself. I think the answer is that if any company had done a deal and agreed to go for 4 years after patent expiration, because that was the years from first commercial sale, and they reneged on it, nobody would do a deal with them again. Okay? So you're right, they are not enforceable in court, but nobody takes them to court. Okay? So go for 10 years, the longer of. Okay? Sorry, the longer of patent expiration, regulatory exclusivity, and years from first commercial sale.
Chances of licensee accepting those terms are higher.
Because they know they're going to ask for it from their licensee. And if you want to be really sophisticated, you can get an example of a license. And I'll show you where you go for those. You can get these licenses with or without financial terms in and say, well, look, this company agreed to this. So, it's reasonable. You might even get a license done by a university with a biotech company that used that approach, okay? So look, it's reasonable. People do it. Have a basis for your negotiation. Remember what I said? Lisa?
Yeah, I was saying in one of the agreement, we have negotiated from the first date of the commercial sale. But because in India we are not, the regulatory clearances are not in the patent thing. So we don't negotiate on that part within Indian context. But yes, from the first date of the commercial sale, we have put that clause in. And that was given on non-exclusive basis because there were technical milestones and there were upfront fees which were negotiated for each milestone. So as soon as you complete the milestone activities, then they will take it to the regulatory clearances and then first commercial sale will start and royalty payment will start from that point.
Okay, good. Problematic issue is combination products. Sometimes the products on sale contain several components that could be considered separate products, and your technology is only in one of the components. And the separate parts may or may not be sold separately. If they're both sold separately, it's easy. You just prorate. If one's sold for, let's say 60% of the combined price and the other one's 60% of the combined price, then half of the combined sales should be, you get royalties on. Oh, I'm sorry, what did I do? Okay, there we go. Issue arises if one component is not sold separately. And historically, licenses often defaulted to prorating over the cost of goods sold. I think that's a terrible way to do it. I was once hired by a pharmaceutical company that had this problem to address, and they paid me to come up with a solution, and I called in every chit I had. I talked to corporate lawyers, patent lawyers, investment bankers, and I could not find a solution. My first slide was, beats me. They still paid my bill. And, do not use words like shall be determined in good faith. When there's money on the table, there is no good faith, and that is a guaranteed arbitration, okay? Never put that in your license agreement, okay? So I think you may just need to allocate equal value to each component. I thought of my drug case. We could look at the preclinical testing to see how much of the effect in the patient came from one component after the other. No, they didn't do the development that way. I couldn't find anything there to do it, okay? You may just have to say, well, it's an imperfect world we live in. We'll allocate half to each license, okay? So let's look at an example. Let's say this would be a pretty common life sciences in the US, upfront 50,000, annual minimum royalties 10,000 a year for the first 3 years, 25,000 5 through 7, and 50,000 thereafter. Milestone payments like this, which kind of line up with clinical development, and a royalty rate of 5%, with sunk patent costs of 75,000, annual patent costs 10 to 25,000. And let's say this is the sales profile of our product. Starts in year 7 at 750,000, peaks at 25 million in 13 through 15, and then starts to decline. This is how the flow of money would look under such a license. Blue are the lump sum payments. Green are the patent costs. Red are the running royalties. Now, several things leap out at you from this, don't they? The early upfront payments are really small, and it's only the late stage milestone payments that are really big. And second, clearly, the vast amount of money you're going to get comes from the running royalty rate. Okay? What this says is your negotiation should be predicated on success. Okay? They will argue much more over the early milestone payments than the late ones, because they know if they get to pay the late ones, it means it's all working and it's worth a lot to them. Okay? I once nearly blew one of the biggest deals I ever did. We were going to do an option first, and then while they evaluated the technology, and then the license if their evaluation was successful. And I blew it by asking too much for the option fee. And he said, nope, won't do it. Bye. Hung up the phone. And so I thought about it, and I went back to him and ate humble pie. I said, I'm sorry, you're right. The important numbers are if the technology, your evaluation works, and the technology, you want to license it. So I back off, your number is acceptable. And luckily, the guy said, okay, and we finished up doing the deal, and that was one of the biggest deals I ever did. But I nearly blew it by trying to get too much up front. Ooh, whoops. Oh, dear. Thank you. Sorry. Yep.
Yeah, in the option sales, when we are collecting some commitment fees from the licensee, should that be down payment or license considered as a licensing fee? Because I haven't given him yet a license. What is the terminology for that fee structure which would be collected for the option thing?
Well, I don't think there's any rules. I think it's whatever you negotiate. I think an option fee should not be refundable if they don't go forward. But if you want to offset it against the upfront fee, that's fine.
This comes in the audit. When you're doing an audit, and these people will ask for details. So will that be a consultancy fees, sponsored fees, license fees? Then, because the money is not part of a license, where we should park is a question.
So a good question would be, should I distribute my option fee to the inventors? My attitude is, if it's non-refundable and it's because of the technology, I would distribute it. I would never refund it, but I think offsetting it against the upfront fee, crediting it, that would be reasonable.
As an upfront fee?
Yeah, yeah. And sometimes, you want to have a term sheet attached to your option so that they know what they're going to have to pay for the technology if they want to move forward.
That would be a deal breaker, because most often I would prefer not to say that. We would come back to the actual values after the valuation.
Yeah, but if I'm them, I'm going to say, look, I'm going to put significant cost into evaluating this technology, and then I come back and say I want it, and you hold a gun to my head. I would want to know what it is up front, okay? And that is, it's much easier to reach agreement on the terms than on the finished license. That's a much longer, costlier process. So agreeing an option, the terms up front, would be great. John.
In America, we've been at this for 40 years. Companies have realized it's fatiguing to do clever new things. They do their own homework, and find that the quickest way to get their hands on the technology to understand whether it's worth scaling or not is to do the typical deal. So they phone around and talk to people and understand this is the way that the universities operate. These are the typical terms. So in America, 40 years of effort have allowed people to arrive at a consensus fairly quickly, because everybody has done their homework of how it's done in America. Years ago, when that was not the case, you really got into arguments as to this, that, and the other thing. But nowadays, my personal view is that people are much more relaxed. Let's do the deal, seems reasonable for what I want to do with it. Now let's find out whether I can do something with it.
When you say a fair deal, there was an American company who was happening to have this FRAN terms. And he proposed that we would end up in a FRAN terms, but they were determined to be removing.
Do you have the schedule, the timeline for this?
Skeptical why they did so.
I can't comment on a particular case without really understanding what's going on.
So having a FRAN terms is good, or will there be any problem in the future?
How you do it here will depend on the understanding of both parties. So I don't know how to answer your question.
One last was that coming down of the royalties in the last 16 to 20, why would that happen in the case, in general context?
Because the sales went down. We had a flat royalty rate. The sales peaked in years 13 through 15 and then started to go down. And so the royalties receipts go down because the sales went down.
Because the technology is going obsolete, or else?
Who knows? Something new came along, something better. Who knows?
Gotcha.
Okay?
No, thanks.
Yeah. So the schedule says we should stop now and talk for 45 minutes. I'd like to keep going a bit further, if that's okay with you.
This is the case if there is a platform technology, particular case I will explain. So there is a known drug molecule. We want to conjugate it with another biomolecule. It makes it more amenable to go. It will increase the bioavailability, basically. So basically a process or a platform technology. Now the company which is interested, licensee, they can use this platform technology to make increase the bioavailability of drug A, B, C, D, anyway, wherever the chemistry is possible. So in that way, how can I get a value out of this technology, because I'm not selling a product, and they can use it for n number of developing the molecules if they find it possible.
Well, every new molecule they come up with will have to go through the regulatory process and get regulatory approval and will be sold as a different product. You have your basic molecule, and what American drug companies do is, as it's about 2 years away from patent expiration, they come up with the extended release version. And that's easier for patients to take. And so the doctors will shift them from the 3 pills a day to the 1 pill a day, because it's easier, okay? So you'll have the sales of the new product. And you should get paid on each new molecule that they come up with. And a model to look at, I'm forgetting the name of the company, but there is a company in the US that's come up with a way of doing that, and Johnson & Johnson has licensed it and got the molecule in the marketplace. Maybe look at that one, try and find that one as a model.
I think it's a cancer drug.
I think you're right. Okay?
So is it like, suppose they are, just for a better easy understanding, if they are selling that drug molecule, one pill for, suppose $100, the royalty or the percentage benefit that they will get usually, what the licensor will get will be relatively lesser. because it's not a new molecule. You got the point,
Yes, it is.
right? When-
Yes, it is. As far as the FDA is
It is a process.
No,
It's
I
possible.
got when the source, if he's talking about a cancer drug which is say $100 per gram versus a normal drug which is $1 a gram, the process flow is used. So will the royalties be reflected in this sense? So there we can go for a tiered royalties. There was a case where the same technology was used in multiple products, and both the parties have upfront agreed for this one I'll pay 50, this one 30, and this one 10. The reason is based on the costing. When you say on the net sales, that would be boomed for the upper one. That is one approach. Otherwise, there could be a flat also, but whether we negotiate it and the other party accepts for the flat royalty is the question.
But if it's a cancer drug, if it's like breast cancer,
Yeah, cancer.
your numbers are going to be completely different than a pancreatic cancer.
Yeah.
So your valuation will completely differ.
Usually, that's what
I would disagree. I would disagree. You know, you should get the same percentage irrespective of what cancer. And if the price of a breast cancer drug is higher than the price of a pancreatic cancer drug, because breast cancer drugs work and pancreatic cancer drugs don't work, then that will be reflected in the royalty flow.
No, I'm just trying to say, would it be a separate valuation for each?
not needed
Not
is
a
what
flat kind of a thing, that's what.
My focus is more towards the high percentages
Yeah.
instead of really upfront and milestones. So okay, I think maybe we can have a flat
Okay.
royalty percentage.
Yeah, it will be difficult though to convince, because what if they propose a lower royalty rate? So then you're at a disadvantage for across all the cancer spectrum.
Yeah, but let's see, his technology enables this new improved version just as much as the original active ingredient does. And let's say what happens in the US is you go from the 3 pills a day to the 1 pill a day. They'll charge more for that 1 pill than for the 3 pills. Okay? Yeah, because it's more convenient, has a higher value to the patient. So your royalty should reflect that.
I've had experience with the Taxol molecule, okay? And we signed the deal, and royalties started flowing in, and then I realized that my question to the Charles Linsner, the VP at Bristol, was, I'm a little concerned that the women who have the breast or ovarian cancer who are dying are paying me a royalty. They're dying, and I'm making money. So I said, what do we do here? He said, I'll get back to you. And he said, tell you what, we have a royalty rate of 4.25%, which is enormous for a synthesis. And we, Bristol, sell in America, to a drug wholesaler who sells to the hospital buying groups, who sells to the hospitals, who effectively sell to the patient, where the patient is either their costs are covered by private insurance or the hospital steps in. And so, all right, what's the cost to the patient? Well, for each course of Taxol, $800 US. Okay? 3 courses a week for many months. So, okay, let's go through the arithmetic. Here's the arithmetic. The cumulative royalties to FSU were $350 million. Okay? Each step of the way, the group in the American healthcare system added a profit. And so I said, okay, at the bedside, what effectively is the woman paying of the $800 to pay our royalty? They did the calculation, and the answer was, of the $800, 1/2 of 1 cent was used to pay the royalty because of the profit markup in the American healthcare system. Okay? So he basically said, John, Taxol as a new therapy has increased the response rate from 6% to 30%. And so for 1/2 of 1 cent, that life-saving innovation is being brought to the attention and being used by the women. So at that point, I realized, okay, the whole system's kind of crazy, but the direct cost to the patient was something that I felt ethically was reasonable. Okay? So you have to look not only at the royalty rate, but that brings me back to the issue of, I always ask the company, what are you going to do with our technology? And then separately, after they thought about it, how are you convincing your senior management to do the deal? Okay? And I listened very carefully. And I realized the first time, well, I won't get into it, except to say that, okay, this is how they're going to make money. This is the product. So the royalty rate will apply as Bristol sells into others, and our royalty rate is not applicable to the rest. Okay, it's only the spot where that transaction happens. And because of the amount of money that was flowing in, we did a royalty audit. Specialized CPAs who are used to doing this went into Bristol. The Bristol man said, John, we are delighted to have your guys come in. Why? Because we want you to tell your community Bristol pays its bills properly. Okay? And at the end of the day, we did 3 audits. Each audit costs us something like $30,000 to $35,000 US by specialists. We got a report. And at the end of the day, of the $350 million, there was a discrepancy of $100,000 in our favor. Bristol said, oh, we went back and forth a little because Bristol thought that it was, anyway, they ended up paying us $90,000. Another audit we did on a very different situation was the numbers given to us in the royalty report, which had to fit a certain format, which was in the appendix of the license. The auditor went in, and the auditor and the royalty manager in the company realized, uh-oh, the technology is being used for another product. And we didn't report that. Everybody was embarrassed. Okay? So that was corrected through the audit. Right? And again, that was not anticipated when I asked the question up front, what are you going to do with our technology and how are you going to pitch it to the senior people? So my view was brutalized by the fact that we signed the Bristol deal and the damn thing didn't work. I thought, uh-oh. Bristol, for a variety of reasons, had made a major multi-million-dollar upfront payment. We're going to have to give it back. Thank you very much. Anyway, Bob Holton had another technology, which we replaced the technology and negotiated some other terms that would allow him to do a startup company and move forward. It got sorted out. So to me, valuations are something that are worth understanding, but he and I and Dick have had enough experience to realize that when a product gets in the market can crash, change, and there's no way you can calculate that. So it's a matter of, okay, quickly let's get a deal that if it works, will capture some value. And if it's a big deal, we'll audit it to make sure we're getting what seems to be owed and go for it. So the purpose of the valuation is to go to the table and explain to the other side that you've done some homework. Okay? And I'm sorry, I've got to say one more thing. I went to Ashley's course at Autumn, paid $95, listened to him talk for the full day, really thought it was incredibly logical, had the book, went back, did a calculation on a deal, went into the negotiation with my valuation in hand, opened my mouth and started talking and realized 2 things. How on earth could I have the arrogance to tell the guy who was in the market what I thought his market was. He was making the market every single day. Okay? Then he diplomatically patted me on the head and said, "You've done your homework. Let me explain how we do the valuation." Because it's somewhat specialized, and what is specialized are the standards we use in our industry that you don't know anything about. Okay? And so we worked through that, and it became obvious that the products would be this, this, and this. The features would be this, this, and this. It was hoped to work. Okay? And the royalty could be structured a little bit differently for the different product in a different market, a little bit differently. But at the end of the day, it was a case of, is it going to work? I don't know until we try. And then the neckties, which I'll talk about later, we're in the market selling, everything turned out fine, it was marvelous, we were getting royalties and everything else, and then Casual Fridays hit. Our sales went to zero. There was no way we could have anticipated that. So I've got a tiny grain of salt, not for the process of doing the valuation, but its use, okay? And therefore, I have, after that, adapted the situation, asking, how are you going to use our technology, and learning? And then what arguments are you making to your senior management as to why this is important? Okay? And I had 2 instances where the faculty member and I were sitting there, and, this is my last comment. The company said, politely, "You don't have a clue as to the use and the importance of this material in the market. Let me explain it to you. Here's how we see it." And all of a sudden it was like, whoa, there's no way we could have anticipated that. So I, from then on, kept asking questions to understand, put together a deal that was responsive to the current understanding of what was going on, which we then documented, and was open to changes. Okay? But the changes had to be, we screwed up, we want to change this. Yep, sorry. The market said something we didn't anticipate. Okay, let's talk. So that's what how I approach the valuation. Particularly important, one of the things that Ashley talked about are comparables, okay? So that everybody does their homework. Autumn posts some documents, LES used to some degree. So it's a matter of doing your homework and then coming to an agreement. And as I said to you yesterday, you do a deal with the people that are there, and 6 months later they're gone. Or the company decides to sell off the unit. So it's kind of, okay, let's get to a point of doing a deal to let you take the risk, and we'll get a little piece of it works. Okay, so sorry to ramble on there, Ashley, but that's where I come from.
Okay. So you may remember on the 3rd slide, I said, do your homework, have your proposal, and be prepared to modify it based on your discussions with the other side. That's what John just discussed. I will say one thing, this is the only time we'll talk about audits. You should always have the right to audit. And these days, audit provisions contain a requirement that if the auditor discovers a discrepancy, normally of 5% in any payment, then the licensee pays. Okay? Obviously, Bristol-Myers would not have paid for John's audit. The second one he described, where he's only being paid half of what he was owed because of the whole product that they weren't paying royalties on, obviously that licensee would have paid for the cost of the audit. The one audit I did, it was an old license, they hadn't got that term in, I had to pay it. By the way, do you think that if you've done the royalties for the life of the patent, they should stop paying the day the patent expires? Why not?
Because you don't have any limits. They will also have the stockpile of what they have manufactured. That would sold subsequent to
That is absolutely the right answer. The license you grant is normally to make, use, and sell. You don't need a license to sell or to use after the patent's expired, but you should be paid on everything that was manufactured and in inventory on the day the patent expired. My only selling drug, they stopped paying the day the patent expired. And I said, no, you owe me on your inventory. They said, no, we don't. So that's when I had to do an audit. And the auditor went in and came back saying, well, they had this much in inventory, they owe you this much. And they said, okay, and they paid. Okay, I had to, and I couldn't recover the costs, but my $35,000, I think I got an extra $500,000.
That's fine, but what about after the products, after the expiry date, whatever inventory is there, that is already covered, that's rating. But
It depends what you've negotiated.
Yes.
Now, if you license your know-how,
That will continue. For know-how, there's no discrepancy at all. No, in the spirit
but you can get a royalty on know-how. Okay? It's got to be less than the patent royalty, but you can get ongoing payments for the ongoing use of the know-how.
But in principle of the patent law, a patent monopoly rights is given
Yep.
for only 20 years.
Yep.
Me collecting a half a royalty or quarter, whatever is not going in principle that whatever monopoly the government has given for the 20 years, I'm trying to extend it beyond.
No, you're
Let
not.
it expire.
You're saying you're still selling the product, and if they got other patents such that the price doesn't collapse for generic use, they got other patents, and normally the company gets its own patents and the price stays high, and they're still using your know-how, you should get paid something less. Okay? And getting back to John's conscience about getting paid by women who've got breast cancer. The biotechnology industry was based on the Cohen-Boyer recombinant DNA patents from Stanford, right? And it was a very reasonable license, 10,000 up front. I think it was at 1 or 2% of sales.
Product, but it was very small.
Yeah, let's say it was 2%. And because it was licensed not exclusively, activists were accusing universities and Stanford of, a tax on innovation. You're putting a tax on innovation. Well, on December the 11th, 1997, when the Cohen-Boyer patents expired, Eli Lilly did not reduce the price of insulin by 2% to reflect their savings. Their profits just went up by 2%, okay? So I think you've got to say, don't let yourselves be attacked for, profiting from sick people, okay? These sick people are benefiting from the drug, and if it's based on your technology, you should benefit too. Okay, let's go on, because time is moving on.
Yeah, I will just add one point to that. So how we write it in the term sheet is that royalties or financials, they will be paid either until the lasting of the patent life or until series last, whatever is longer.
But you've got to have a step down. You must have a step down when the patents expire.
Yeah, so
Okay.
that we have not done so far. Okay.
As a licensee, there would be a discrepancy that I would not accept for that. And I would say,
Okay, so
most of the times the document goes till the life of the developer. Or its inventory is covered. I'll also cover the inventory, but at any given point, I couldn't have negotiated anything beyond the life of the patent where I'll get.
So that would be the case only when you have something patented technology, right? But know-how है.
Yeah.
Yeah, a question from me. Suppose that we had quoted a value to our IP, and it is well documented that this IP is for sale at this value. No? But it doesn't happen. It may be sold at a lesser price in negotiation. So how do you have a defense in your office for that? Because if we sell at a loss, it will the auditors will say in our office that you had sold it for a loss. So what is the argument?
Let's move on, because I think I addressed the issue of cost and how you value. I'd like to move on, because we've only got about, what have we got, 15 minutes? 10 minutes, okay. So,
Dr. Yogesh can say that if I would not have sold it, I would have incurred, more loss. So I have tried to, make good my loss by selling it.
No,
at a
there are two
price for sale.
perspectives, and I would just go to his actually, sir, the slide he said that there are various methods to calculate, and there would be different values for each. Plus, there are two perspectives, seller and the buyer.
Buyer, yes.
Right? So, seller is obviously going to quote a bit higher, and then they would arrive.
So what he says about audits, so we get this very
No,
frequently,
these
so we have to
logics
make
can
them
be given
understand.
to auditors as well. That we use suppose differential method to calculate these, and this is not loss because we are just pegging a cost.
Yes,
This other
so
person
we
will
need to make them understand that this is what
and
we
in
have
no case
paid.
it would be return on investment in any case.
Yes, but.
okay, look, I'm going to cut the conversation off. It's a great discussion. I love to see that we've sparked this level of discussion amongst the leaders of the profession in India, and this is why you need to have meetings. This is why you need to go to the STEM meetings and meet and discuss these issues. It's what we do at the autumn meetings, okay? The STEM needs to grow. It has far too few people at the annual meetings. So look, how do you allocate value to inventors? I think the default position should be equal shares, okay? Unless they all sign an agreement to unequal shares. You can include non-inventors, people who didn't make an inventive contribution but did a lot of the work. You get to see that happen if all agree. And then how do you allocate value to patents? It may require some judgment. Let's suppose you got a drug and you have a composition of value patent is most valuable, method of treating, formulation, manufacturing, less valuable. I mean, John's Taxol, 4.25% for a manufacturing process is incredible. But that manufacturing process enabled the drug. The NCI discovered Taxol from the bark of the Pacific yew tree, okay? There are not a lot of Pacific yew trees. They grow very slowly, and they are the sole habit of the white-spotted owl, an endangered species. And until Professor Holton came along, we were looking at a horrendous fight between environmentalists who wanted to protect the white-spotted owl and women's health activists who wanted this drug to treat uterine cancer, okay? And Holton's process solved that. It was as good as the composition of matter because it enabled the drug, with one exception. It only applied to that manufacturing process. And as John said, after about 9 years, Bristol Myers came and said, got news for you, John. We ain't using this chemical process anymore. We're going to do it by biotechnology. And John's royalties went away. But John's process enabled that drug, okay? And how do you allocate value to institutions? If you've got a joint collaboration with another institution, how do you decide which one gets how much? Maybe do it per patent in the technology bundle, or quantitative approaches. You could look at how much each institution spent on developing their part of the technology, number of inventors, things like that. Remember, always have a basis for your proposals. Let's see, we have a drug. Composition of matter was institution 1, method of treating was the collaboration, formulation was institution 2. Allocate weights, composition of matter 3, method of treating 1, formulation 1/2, and here's what you get. And so institution 1 would get 350 parts of 450, institution 1 would get that, 78%, 22%. You've got a basis, a rational discussion. Institution 2 says, no, we're not worth half. We're at least as important as the method of treating. You can agree it, you can disagree it, you recalculate, okay? The basic ways to approach valuation. Here's what an economist will say. There are only 3 ways to value something: cost, income, and market, okay? The licensing guy's perspective: cost, rules of thumb, industry standards, ranking and rating, discounted cash flow, Monte Carlo, auction, common sense, equity, all sorts of ways. Today I'm going to talk very briefly about cost, rules of thumb, industry standards, comparables, and discounted cash flow. So look back. What did it cost me to develop this technology? And my valuation is I want my money back and I want a profit on that. Okay? Pretty reasonable. Question you have to ask yourself, is the cost to develop relevant? The price of houses in America is very public. You have to register the value. You can look up my house and see I paid $155,000 for it in 1983. You might be able to find the approved cost of the improvements I put into it. Would that be relevant if I wanted to sell my house tomorrow? Not remotely. I wouldn't expect the buyers, prospective buyers, to say, but you only paid $155,000 for this, and now you want $3 million, which is about what the value of my house is in my town after the inflation lately. So is that relevant? You know, ask yourself, would you want to or be able to sell a used lottery ticket for what you paid for it? No. If it's a losing lottery ticket, it's worth scrap paper. If it's a winning lottery ticket, it's worth a lot more, right? And you might find companies saying, but this didn't cost you anything. You had a grant to do it. And the answer you would say is, well, yeah, but the person who gave me the grant wanted me to get value from the technology that came out of it. Two areas where I think cost enters in academic license negotiations: sunk patent costs. The first thing we put on the table is sunk patent costs. And as I said, you can look at it in the relative ownership in a collaboration. Now let's look how this might work out in practice. Let's say you've got a technology and the seller says, look, it cost me $50,000 to develop this. I want to double my money. I want $100,000. On the buyer's side, first buyer says, well, it cost me $40,000 to redo this. I'd have to license in technology that's costing another $40,000. It would take me 2 years, so the value of being out of the market that long is another $40,000. It's worth $120,000 to me. Oh, you only want 100? Great deal. Sign me up. Let's say we got another buyer who says, nah, I could do this myself in a year for $20,000. A little IP, another $20,000. And 1 year delay in getting to the market, another $20,000. It's worth $60,000 to me. You want 100? No deal. So you can see it's an imperfect tool, but it is a tool because you always have data on how much has gone in the technology. Remember, you gotta have a basis for your proposals. Some examples of cost-based valuations. Several universities in the US, particularly the University of Minnesota and Penn State, in sponsored research agreements will give the licensee or the sponsor a fully paid up license for some additional percentage on the cost of the sponsored research agreement. That's 10% more. You know, it's $1 million sponsored research agreement. Give me $100,000 and you've got a fully paid up license to anything comes out of it. And then there are disease foundations that will often invest or give grants to universities to develop technologies to treat the disease they're interested in, and they often demand royalties in return for their funding, and the royalties are typically capped at 2 to 3 times the amount of that they've invested. Look at your hand, the rule of thumb, the 25% rule, also known as the Goldscheider principle after Robert Goldscheider, who invented it. And he said the licensor should receive 25% and the licensee should receive 75% of the pre-tax profits from a licensed product. So this is an income-based process, right? We're saying what is the income the licensee is going to get from it, and we should get a share of that income. He based this on empirical observations. Back in the late 1950s, he was licensing technology developed by the leading American TV company, Philco. And they weren't going to license that stuff to other US manufacturers, but they were happy to have their technology used outside the US. And by the way, there were standards then that meant TVs from other parts of the world wouldn't work in the US. And he had a complete IP portfolio. And he found the licensees were making a 20% pre-tax profit and paying a 5% royalty, and were either number 1 or 2 in their markets, despite strong competition. the licenses were a 3-year term. So they were readily negotiable if the terms were inappropriate. They might say, okay, this is too much, but I'll hang in here, and when we renegotiate, we'll get a better rate. But they weren't doing that. They were happily renewing the licenses. So he concluded that this resulted in successful long-term win-win relationships. Okay? It's kind of like, you know, that magical law, Moore's law, on semiconductors, right? The number of semiconductors that can be put on a chip doubles every 2 years. You know, just an empirical observation that has stood the test of time, and the 25% rules like that. And it's applicable to fully enabling technology. You might need to prorate it if other IP is also needed. It's applied to fully loaded pre-tax profits, not the gross margin. You express it as a percent of net sales in a license, and I said never use profits in a license, right? Use net sales. So the royalty rate is 25% times the expected pre-tax profit margin.
Yeah. So in the previous slide, you have mentioned that there could be a clause that terms could be renegotiable. How common is that you put that clause in a licensing agreement?
Never.
No.
I mean, these were 3-year licenses. So at renewal, they might say, I'm sorry, that royalty rate's too high. You've got to bring it down. Okay, but you never have renegotiation in a license. Okay.
I mean, after a while, why can't we have a renegotiation? Based on the market, I might, if the market is making good and feels like whatever royalties that I've quoted or the licensing fees what I've taken is bare minimum to that what you're made.
Too bad. You did a bad job up front. Okay? You only renegotiate if both sides want something. Okay? And as I said, I'm looking at this, I'm working on this lawsuit right now with this 40-year-old license to a hybridoma. And the licensor wants, you know, better terms. Well, we don't want to renegotiate. The first mantra of tech transfer, the first law of tech transfer is a deal is a deal. Okay? Never forget that. A deal is a deal. You only renegotiate if both sides want something. If only one side wants something, tough. If I want something from you, I'll come back and we'll talk. But a deal is a deal. So here's an example for a patent that fully enables the product. $200 sale price, $100 cost of goods, $50 sales, research, and administration, $50 pre-tax profit. Patent owner share, 25%, $50, $12.50. Okay? Royalty, 12.5 over 200, 6.25%. Patent, 75% enables the product, 4.69, and so on. Okay? You wouldn't have those precise 4.69. You'd say, I know, 4 3/4, something like that. I haven't found it a very useful thing in academic licensing because of the early stage. You don't know what the business is going to be like. I found it very helpful when I was going into a new industry. I could look up the profitability of that industry and base my proposals accordingly.
Yeah, so in the earlier slide, the previous one, you have mentioned that when
Product is 100% enabled.
yeah, so patent 75% enables a product of 50% or 10%. So, I mean, if in a technology, in a product, there are suppose 5 different things and 5 IPs are involved. If I remove any one of these, it makes product ineffective. Okay. So how do I put a percentage? 75, 50.
That's a different issue, I think. You know, that's what we call royalty stacking, when a number of technologies are required for a product. I once calculated that for Humira, the rheumatoid arthritis drug from AbbVie, before some of the early patents expired, about 23% of the sales were going in royalties to different institutions, okay? And then they started expiring and so on. I do want to go on because we're kind of rapidly running out of time. Looking around, industry standards, comparables. Probably the most important valuation method for academic licensing, as John just said. Several times, I mean, twice I heard Merck say, We don't do a from scratch valuation until we're looking at a phase 3 drug. Up to then, we just use comparables. And I verified that asking a Merck person. Other drug companies, I don't think, take the same attitude, but that was what Merck said. So where do you get comparable transactions? You know, when I'm going to sell my house and I want to look at what other houses like mine have sold, I can go to the registry and look up those sales prices. Is there a comparable thing for, you can look them up on Zillow, is the website for the US, and is there a Zillow for IP? So here's where you can go. You can look at internal database. If you're an institution that's done a lot of deals, you go back and look at history. Published surveys, public announcements, word of mouth, litigation, and then required disclosure. So internal database, you know, your institution has done other deals. You know, if you've licensed an antibody for research purposes 5 times, you got 10% every time. That's a pretty good indication you can get 10% for a antibody for research purposes.
Geography will impact the comparables, like when geography, when I'm checking for an antibody deal for US would be 300 million. And in Indian context, the same comparables cannot be implemented or considered.
Yep.
And if you say do consider in India also, when I'm doing the same set of transaction for an MNC versus a medium-sized company will differ. How to come to the consensus on the comparables when it comes to geography and MNCs?
Yeah, well, you've got to look for deals that are relevant to that territory, and depends on how easy it is to find them. Okay? So you look at the licenses your institution's done and the trends over time. Surveys, not many, most are old. 3 good current surveys, LES, they do a biopharmaceutical survey every 2 years. The 2023 one is in preparation now. They've done a few high-tech surveys, and they've done 1 chemical survey. So the 2021, they had 116 complete responses. These were the most prevalent. 84% were exclusive, 59% included the US, and 54% were global. 61% were before entering clinical trials. So that's really helpful for universities because our stuff is generally pre-IND. 50% had expected peak sales of more than 500 million. Royalty structure, 53 were fixed, 54 were tiered, 9 had no royalty, and 2% had a profit-sharing mechanism. They have different categories. This is preclinical, and this is phase 2. So after phase 2, you have proof of efficacy, so you can see the risk has gone down because we know it works, and so the royalty goes up, okay? And here is tiered royalties versus the flat rate. You can see the tiered royalties kind of start about where the flat is and then go up at higher sales levels, okay? Autumn has the Transact database, launched in 2015, has academic deals. You can either contribute some of your deals to get free access, or you can pay for access. Has severe limitations. Subject matter must be selected from a pick list, and all of healthcare is the same code. It could be more subsetted. And like a search for small molecule drug yields 80 hits, of which 26 have royalty rates. And you can't download all the data into a spreadsheet for analysis, which would be very helpful. Do it one by one. I think it's probably most useful for deals outside of healthcare. Required disclosure is contained in filings to the Securities and Exchange Commission. So companies that are public or want to go public have to file all sorts of data with the SEC. And this is reported in things you can get off of the government website, the SEC website. They're in S1, the IPO prospectus, the annual reports, quarterly reports, or special events. It's only for material transactions, which is something that is at least 10% of a company's sales or 5% of its assets. What that means is in a deal between a big company and a little company, it will certainly be material to the little company, unlikely to be material to the big company. You can redact commercially sensitive information, like the royalty rate, like the payments, from public disclosure, and that's certainly increased since we went to electronic filing, but the redaction is only good for 5 years. And some of the databases are really good at going back to the SEC after the 5 years and saying, okay, now give me the good stuff. So you've got to identify comparable transactions will be helpful, determine if the agreement's been filed with the SEC, and find it. You can get it from the Edgar system, much more user-friendly now, and the companies phased in progressively, the largest in January 1994 and the smallest in May 1996, so we've got close to 30 years of data that's available. There are databases that collect this. These are some for technologies, and these are 3 for life sciences. They're all charged either per agreement or an annual subscription, and they're quite expensive. And a couple of them let you identify an agreement before you have to pay for it. So you could then find them yourself through the SEC. Search strategies do a no cost using some of these. High cost, you can take out a subscription to these. I don't recommend that for academic licensing offices. They're too expensive. And you can use a consultant for a specific technology, and they'll probably do something for $2,000 to $3,000. A newer way to use SEC filings, companies seem to be making much more detailed disclosures of deal terms. Yep, 2 more minutes. Okay, and the 10Ks are much easier to find and search than attached agreements. So here was an example I did for an Asian university developing a cellular therapy, and I said chimeric antigen receptor T cells were the best comparable, and a leading US company was Juno Therapeutics, and in their 10K, I found 5 academic deal terms identified. Fred Hutchinson Cancer Center, $250,000 up front. These annual minimums, milestone payments of $6.75 million, low single-digit royalties, 3 to 4%, and a portion of payments from sub-licensees. And here was another one from Sloan Kettering. Okay, so comparables are really, really important, and I think that's what you're going to use. You will come across discounted cash flow, which is all about the time value of money. I really don't have time to go into it now. I wish I did. You know, this is normally at least a 90-minute talk and often goes on for a half a day. I don't think it's of importance for academic institutions, but it's really important for big companies. So I think you need to understand DCF. Let's see if I can get quickly to the end.
The slides would be shared with us, right?
Yeah. Okay. And here's an example, an indenture from the 30th of May, 1923 between the University of Toronto and Eli Lilly. Anybody know what that agreement's about? 1923, yeah.
It's a cancer drug.
No.
1923. Human insulin. Discovered at the University of Toronto, the first major academic license in healthcare. And they paid a royalty of 5% for a 1-year exclusive. So if in doubt, 5%. If you want some more information, go to the WIPO website, put my name into the search box, and somewhere you'll find the Intellectual Property Valuation Manual for Academic Institutions. WIPO paid me to take my complete course and turned it into a book, and you can find it there. Okay? Sorry we ran too long.
So with the 40, 10 minutes